This is a short introductory video to the Philips Respironics T70 Cough Assist. This is the on and off switch. Down here we have several different tabs. We have our settings tab, our menu, and our therapy. When we want to start therapy, we push this button. Notice it says standby. When I want to get done with therapy, I push it again, and therefore we're now on standby. In the settings tab, we can go ahead and go to settings. Notice that we have a screen. There are 3 presets. One, let's go ahead and highlight that and modify. These are presets. Okay, so if I was to go ahead and confirm that, I have a mode. I can go ahead and modify the mode and change that from manual, which you would use this toggle switch right here when you're going inhale and exhale right here. And if we wanted to go to auto, we would go ahead and say, let's go ahead and change that through using the butterfly switch, the toggle switch, and I would confirm. Then the highlighted portion of the menu shifts. The cough track, we'll go into that in a moment. We're going to come down and change the inhale pressure. We can increase or decrease this. I'm going to go up to 40. I'm going to say OK. And then I have 3 options for inhale flow. I'm going to modify, and I'm going to come back over here, and I got high, medium, and low. I'm going to say I want to keep it on high and confirm. When I come down to the pressures, the exhale pressure and the exhale time and inhale time, I have these both at 2.0. I'm going to change this cough track to off, and notice that I have a pause that happens here, pause time 2.0. With cough track, the pause time goes to 0 and actually somewhat synchronizes to the patient's needs. When they want to go ahead and take a cough, they can do that right away without waiting. I'm going to go ahead and push finish. And now we are in this menu right here. Everything's standby. Notice we have a peak cough flow, and we also have a tidal volume. So I'm going to go ahead and do therapy. Now up here I have the calibration line. Okay. I'm going to come down here to the screen. Notice the peak cough flow and the tidal volume are adjusting. So now I'm going to demonstrate with the cough track on, and feature is on auto. I'm going to go ahead and say therapy on. Notice my calibration lung. I'm going to go ahead and start to give a little bit of a breath. I'm going to give a little bit of a squish, and it pushes out and then coughs out for the patient. This will help clear the airway. Should help the patient cough. Notice it's just waiting for the patient to give some effort. A squeeze. So this is a great feature for these patients. In the settings tab, I'm going to adjust this so that the cough track is on, and I'm going to come down and I'm going to change these to inhale pressure of 1 centimeters. So I was at 40 and 40, for example. I've now changed them to +1 and -1. What this is going to enable me to do is to be able to see how well this patient's able to cough. I'm going to get some peak cough flow readings that's going to tell me how well this patient's doing. It's also going to tell me what the tidal volume is on the patient on 1 full respiration and cough. So I'm going to go ahead and push finish. Have this on auto, so I'm going to go ahead and turn on the therapy. Now we're at -1 +1. It seems like nothing's really happening right here. That's because the patient's really not giving a big breath. So I'm going to come up here to the calibration lung, and I'm going to push. So if you can look at that, I'm going to push this calibration lung, and I'm going to get some very low volumes and peak cough flow. Push really hard. So if this was an average patient, anything under 160 liters per minute would be a really bad situation for this patient. The data card is located on the left-hand side. It's got a little rubber cover. I'm going to pull that off, and I can reach in and get the SD card. And I can put that in my computer and use the directed-view software and generate some reports for the doctor. On the back of the T70, I have my filter, the plug input, and also an optional battery. Now this doesn't come with a battery standard. I actually took a Trilogy ventilator battery and plugged it in. I had to take the cover off. It took a little while to get it off. And so I can actually run this 3 hours with a battery backup. Over here is where I can put my tubing and hold it in place. Just like most RAD devices and ventilators, you want to have a bacteria filter. You can use standard CPAP tubing. It comes with a 2-meter hose in the box and also a medium-sized cough assist mask. I'm going to demonstrate the use of a cough assist mask. This is a medium-sized mask. I'm going to go ahead and push the therapy button on the cough assist. I'm going to put this over the ridge of his nose. We're already running, and put it on. The patient will go ahead and take a breath if I'm in auto mode. If I'm on cough track, it will start cycling with the patient. I'm going to do this 3 to 5 cycles and then give the patient some relief. The T70 does come with a bag in the box. It also has a little place where you can put your business card or information about your company so that the patient can call you.